So if an elderly person with diabetes starts complaining about their ears for a day, 2, 3, or a week, 2 or 3, don't ignore it. They must get checked, and if they need to be hospitalized, they must be admitted. There's a type of inflammation that occurs in the external ear canal. This outermost canal, which goes from the pinna all the way to the eardrum, can get a very common infection in diabetic patients. Diabetic patients with low immunity, those not taking their meds properly, even if they do but their sugar is high, get these ear canal infections caused by a bacterial microbe, a type of bacteria. The problem with this infection is that it's not just limited to the ear canal. It's not confined there. Unfortunately, because the patient has diabetes, this inflammation reaches the bone inside, the bone that forms the ear canal. The bone of the ear canal is essentially the bone of the skull base, meaning this ear canal is inside the bone that forms it, inside the skull itself. So if an infection spreads from the ear canal to the underlying bone that makes up this canal, it becomes a very nasty type of infection. Like other bone infections, we all know that bone infections are difficult and their treatment takes a long time. These infections require proper treatment and very good control of blood sugar levels. Peace be upon you and the mercy and blessings of God. Yesterday, a patient came to me saying, "Doctor, help me, my mother is elderly. She is 65 years old. She's complaining of ear pain. She's never had ear issues before, but there's this very strange pain that's lasted 3 or 4 weeks and won't go away. I've had her checked several times and they say nothing's wrong, but this pain is abnormal and it's bothering her so much she can't sleep. It's somewhat tolerable in the morning, but at night it gets so bad that she hasn't slept for 2 days. So I asked her, "Is your mother being treated for diabetes?" She said, "Yes, her sugar is terrible. She takes insulin and it won't go down. For 2 or 3 months now, her sugar hasn't dropped at all." So what could be the problem with this lady? What's causing this ear pain, and does it have anything to do with diabetes or not? This inflammation that's happening, actually, when we look at the ear, we find the ear canal is completely blocked. We see something like granulation or tissue or a type of inflammation that's totally closing the ear canal to the point where we can't even see the eardrum. We perform many scans to diagnose this condition. For instance, we sometimes request a CT scan to see if the bone itself is affected or not. We also request an MRI sometimes, and other times we ask for a bone scan to see if the bone is breaking down or if the infection has reached it and is causing a problem. The lady was very scared. We try to reassure these patients, but in reality, we worry about several things. This infection, as I told you, is in a very critical location. What could happen? What problems might arise? How far could this infection spread? This infection causes truly severe pain that the patient suffers from for weeks and months. If it's not diagnosed correctly, it can also affect the nerves. The first nerve affected is the 7th nerve, which moves the face. So this woman might experience facial paralysis on the side where the ear is infected. Also, other nerves can be affected. The facial nerve is the 7th nerve. The 8th, 9th, 10th, 11th, and 12th nerves as well, because most of the nerves emerge from the base of the skull, which supply many things. These nerves can have many issues. I don't want to overwhelm you with details, but if the infection is severe, it can affect these nerves. It can also spread outside the ear canal, reaching the parotid gland or the joint. Swelling often appears in front of the ear like this, due to the microbe reaching the jaw joint, so the person can't even open their mouth. Anyway, this woman actually came to me. I saw her and found granulation, or inflammation in the external ear canal, and her blood sugar was very high. It was 400 or 500. So the first step we take with these patients is to admit them to the hospital. Hospitalization is primarily to stabilize their blood sugar, because if blood sugar isn't controlled, there's no hope for recovery with just antibiotics. So first, the patient is hospitalized to stabilize their blood sugar. We have an internist or endocrinologist see them to adjust the insulin dose, whether they're already on insulin or need to start it to regulate their blood sugar. Then we also run some tests, including inflammatory markers and sedimentation rate. In the scans I mentioned, to see exactly how far the inflammation is spread in the ear canal and how far it's moved into the base of the skull. We also give strong antibiotics for the microbe that causes this disease. We might also take a tissue sample or a sample of the inflammation in the ear because we're also concerned it could be a tumor. This condition is very similar to tumors that occur in the ear canal. So we take a biopsy to ensure it's just an infection and not a tumor or anything else. Okay, Blood sugar will be stabilized in the hospital with plenty of IV antibiotics. We monitor the pain and signs of inflammation. Also, it must be cleaned every day. The ear canal is cleaned, removing all secretions, pus, and other issues inside the ear to keep the area clean, and we try to treat the canal and the underlying bone. The antibiotics aren't just taken for a day or two. If the infection reaches the bone, antibiotics aren't just for a day or two. They're taken for at least 6 to 8 weeks. I won't keep the patient for 8 weeks, just until signs start to improve. We also don't stop this patient's treatment until we see signs on the x-rays telling us that we've started to improve. That feeling of pain that comes at night, we monitor it every day for the duration of the hospital stay until it starts to get better. And the signs of inflammation decrease, and the swelling around the outer ear, the jaw joint, or the parotid gland, and all those things subside. The seventh nerve, or the nerve that moves the face, improves. Then we can continue treatment at home. Of course, blood sugar must be controlled. Regular follow-up with the doctor is a must. Are there other things? Because the patient is often very scared, as the pain they have is so distressing that being in the hospital and being admitted frightens them. So they ask me, besides antibiotics, can we take other things? Well, there's a type of treatment called hyperbaric oxygen. It's a chamber where we increase the oxygen pressure around the periph. They enter a closed room, and in this room, the pressure is high and the oxygen level is high. It's said that high oxygen in the air, when I increase the oxygen pressure, it increases the oxygen entering our blood, and therefore, for diabetic patients and those with weak immunity, where blood doesn't reach the tissues well, when we increase the oxygen, they start to respond well. We continue the treatment for at least 6 weeks, and after those 6 weeks, before we stop the treatment, we must do an x-ray to prove that the tissues are responding to treatment and inflammation is subsiding. So if an elderly person with diabetes starts complaining about their ears for a day, 2, 3, or a week, 2 or 3, don't ignore it. They must get checked, and if they need to be hospitalized, they must be admitted. Rest assured, God willing, things will go well, and everything will be fine. God is the healer. Wishing you a speedy recovery. If you like these videos, please like and subscribe to the channel so we know you want more new videos. Wishing you a speedy recovery.
Bell's palsy. Why would someone suddenly start complaining at first of a vague pain around their ear that they don't understand and don't see a doctor for? And then within a few days, they find that the left or right side of their face won't move at all. Meaning they try to raise their eyes, one goes up and the other doesn't. They try to raise their eyebrows, one goes up and the other doesn't. They try to close their eye, one closes and the other doesn't. They find their face isn't moving. They try to smile, one side pulls back and the other doesn't move, so they get terrified. Well, this condition is called Bell's palsy,